Hi, Dr. Kristen here from Every Family Chiropractic. So for about the next 10 minutes or so, I'm going to talk to you guys about technology. So in our office, we have 3 T's that we often talk about with our patients, and these 3 T's, they are things that negatively affect the spine and the nervous system. Those are thoughts, traumas, and toxins. However, we decided to add a 4th T, and that 4th T is technology. Essentially, it's a combo of the other T's, but it affects the spine so substantially these days that we feel like it deserves its own category to itself. So one of the phrases that a lot of people have heard about, the kind of a catchphrase, I guess, is text neck, or some people say tech neck. That's the main thing that we think about when we say how technology is negatively affecting our spine. And the way that it's doing that is exactly what it sounds like. Text neck is that posture that you're in, that interior forward head posture when you're looking down, texting at your phone. And the reason why it's affecting the body so much is because of how much time we actually spend on our phones looking down at it. There was a study done a little while ago saying that the average adult spends about 2 to 4 hours a day looking down at their phone. I would probably argue it's a little higher, and we all definitely know it's much higher for kids. They're on their phones constantly. So one of the things that I want to start with are the structural implications that happen when we have this constant forward head posture. So when our head is forward like that, our shoulders follow suit. So our shoulders end up rolling forward to make it more comfortable to have our head down. Because if you put your head down and you try to pull your shoulders back, it's very uncomfortable. So when we have that rolled forward posture, we end up making these pectoral muscles really tight, and we're stretching out the muscles in our back, and then our shoulders kind of stay that way. The problem with that is that you start to actually decrease your lung capacity. So up to 30%, you can actually decrease your lung capacity when you've got those rolled shoulders. So you can imagine how big of a deal that is for somebody who's already struggling with something like asthma. You can't decrease that lung capacity even more. So it's really important to pay attention to when you've got when you've got your head down and you have your shoulders rolled forward, get your body back up, get your chest up. So the other thing is muscles get used to being in the same position all the time. Having that constant posture where you are shortening some muscles, you are lengthening other muscles, eventually our body is going to want to stay in that position. So we've got muscles that are chronically inflamed because they're being pulled much tighter than they are used to being. And that's what leads to that prolonged bad posture, because our muscles end up being kind of stuck where they're at. You know, parents are always saying, don't make that silly face or it's going to get stuck that way. I mean, really though, if you made that silly face for hours and hours a day, every single day, there's a chance you could get a little bit stuck that way. The same thing's happening with our body and our posture. The nice thing about chiropractic is that our body wants to be in the correct posture. So when you're getting adjusted, you are speaking to the muscles and the tendons and the ligaments and all the nerves, of course, and they are wanting to tell the body to be where it should be. So when you're getting adjusted, your muscles are all trying to reset, so it's combating that bad posture that you're having throughout the day. So there's a less and less chance of you ending up with that posture permanently when you're getting adjusted, because you're going to go like this, but we are talking to the body to get you back up like this. So something else to point out with that forward head posture, because a lot of people don't realize how much it's affecting our body or how much pressure it's adding. Because if you just put your head forward, whatever, it feels like your head is forward. But every 1 inch forward that your head is, your ears are from your shoulders, you're adding 10 pounds of pressure. So if you think about the typical posture when you're looking down at your phone, most people are at past 45 degrees. So if you're at 60 degrees of having your head forward, you're adding 60 pounds of pressure onto your spine. That's essentially like carrying around an 8-year-old on your spine. And like I was saying before, having that bad posture can actually get it so that your muscles and tendons and ligaments want to stay in that position. So even when you're not texting anymore, your head is still forward. You have a child sitting on your spine all day long. At least that's what your joints are feeling. So this is how people end up with really early arthritis in their spine. I know a lot of high school students think that they are immune to all the problems out there in the world, but I can tell you from experience that I went to a chiropractor when I was really young. I was pretty much told that I'm going to have arthritis in my early 20s if I did not fix my posture and fix the curve in my spine. And it's happening even more so because I was not part of that generation that was on my phone all day, every day. So it's a little bit more important for these younger kids today to be focusing on that because they're not really feeling the pressure that's actually being put on their joints. So what are some of the symptoms that people have when they have this forward head posture? Basically, when we talk about pain, headaches are a very common one. Neck pain, of course. Upper back pain, because we got that 8-year-old child sitting on our back all day. However, in these initial stages, a lot of people don't experience the pain, especially our younger kids. So when you're an adult, you've had years and years and years of damage and scar tissue added up. So our body lets us know when something's bothering it because it's sort of like that last straw that broke the camel's back. But when they're young, they haven't had a whole lot of damage yet to their spine. So they haven't hit that tipping point where their body is going to make them aware of the pain that they should be feeling from having their head forward. Plus, there's, of course, the whole fact that only about 10% of our nervous system feels pain. So damage is being done long before most people realize that there's a problem. I tell most of our patients that pain is the last thing to show up. So if you are coming in when you're in pain, most likely, I'd say 90+% of the time, the issue started a while ago and it's finally hit the point where it's letting you know that it's in pain. Let's see here. There's also the pain. Apart from the pain, that's not a good thing in terms of symptoms of the forward head. The main thing that I like to focus on, since I'm a chiropractor and I focus on the nervous system, is how that forward head is actually affecting our overall health. One of the things that tends to happen when people have this bad posture due to technology, and I keep saying text neck, but that even goes with people sitting on their bed with a laptop on their lap. They're looking down like this. People sitting with an iPad watching TV in a waiting room, which I see all the time, they've got their head down like this. So it doesn't just mean looking down at your phone. It has to do with a lot of different technological things that we do. But anyways, when I was talking about that permanent postural change that we have, one of the things that will start to happen is it will actually start to affect our spine. So the muscles start to change long term, and it's going to want to bring the spine with it because every single vertebra has muscles attached to it, and if those muscles are constantly pulling that spine, eventually your spine is going to change its shape. So the natural curve of our spine is to go this way in our neck. So essentially the curve is this direction. So you can imagine how when we're bent forward, we are pulling that spine into the opposite direction. One thing that is way too common for me to see in young people is a straight neck, so they can also call that a military neck, or a reverse curve. When you've got that, you are essentially putting a lot of pressure on the spinal cord, because all the curves are the way that they are in the body for a reason. It's the least amount of pressure on all of our joints and on our spine. So when you then take the spine and pull it the other direction, you are pulling the spinal cord and putting a lot of pressure on our nervous system that communicates everything in our body. You are also damaging joints and putting a lot of pressure on nerves, and those nerves communicate with something. So that means that the communication between our brain and our muscles, organs, and essentially every function in our body is substantially decreased. So what can that look like when the nerves from, say, occiput, base of the skull, all the way down to T5, which is just getting into like between the shoulder blades, what kind of symptoms can you see when those aren't functioning properly? Some things include vertigo, thyroid issues, high blood pressure, anxiety, lower immune system, pretty much anything that you can think of. And one big reason for that, I'm going to point out just one nerve that is a very big part of the nervous system, the vagus nerve. Comes out right at the top of the neck here. So the vagus nerve is one of the main components of our parasympathetic nervous system, and that's essentially our rest or digest. We have a tendency in the United States to be in constant fight or flight, so that parasympathetic calms that down, and helps people function at a more relaxed state. So if the vagus nerve is not functioning properly, mood is very much affected. I can tell you that back when I used to be stubborn and not get adjusted all the time like I should, my mood was one of the first things affected. I was very cranky and my anxiety would increase. Anxiety is a really big one. Immune response is something that the vagus nerve controls, along with digestion and heart rate, along with many other things. So you can see just having pressure on that one nerve as a result of any type of reverse curve, straight neck in the spine is going to have a lot more implications than just pain and discomfort. So how does chiropractic help with that? Basically, we are re-stimulating that nerve when we adjust to get it to function properly again. So what will happen is when something's putting pressure on nerves for a long period of time, they sort of give up, they stop talking, and we are making sure to get those nerves talking again so that they can work hard to function the way that they're supposed to. Another way of looking at how technology affects our health is just by looking at the act of sitting in front of a computer up to 8 hours a day. All the people out there who have a job that involves sitting at a desk know exactly what I'm talking about. So all this stuff that I just talked about, hunch forward posture, of course that's a part of it. But now we're adding in sitting for very extended periods of time. And when you're sitting, we tend to lose our posture. We curve our lower back into the wrong way as well, because our lumbar spine, that low back, is actually curved the same way as our neck. And a lot of people have a tendency to slouch, which is essentially curving things this way instead of keeping it this way. It's nice to have that low back support, but you're still sitting for over 8 hours a day. Something to think about. When you are sitting, you are adding 40 kilograms more pressure onto your low back than if you're standing. If you are sitting in a lazy boy or on a really soft couch where you tend to lose that core activation, you're adding 80 kilograms of pressure onto your low back. So that's why we try to really promote that people get standing desks or get up and walk around every hour. At least try to get up 5 to 10 minutes and walk around. It would be awesome if you could sit on a workout ball. I'm trying to think exactly what those are called, but those big balls that people use to work out, you can sit on those. That helps activate your core so it keeps you in correct posture. There's also things called seat discs or wobble discs, and they're a little smaller. They're about this wide, and they're like slightly curved so that when you sit on it, it has the slightest bit of wobble, so it causes you to have to sit up straight and activate your core so that you're not letting your posture get bad. So when you add in the sitting at a desk for 8+ hours, now in addition to all the health things that I talked about, when we talk about pain, now we've got neck pain, shoulder pain, low back pain, hip pain. So basically the entire body is hurting from having to sit in front of a computer all day. Another negative of sitting in front of the computer all day is just the whole act of being sedentary. And this can also go past being at a computer. Students, for instance, they're sitting at desks almost all day. They go home and they sit in front of the TV, or they sit in front of and play the TV and play video games. So they're watching TV or they're playing video games. That's even more time of being sedentary. And I think there's no argument here that a sedentary life leads to an unhealthy life. You need to get up, you need to be active so that we are not hurting our health so substantially. So what can we do to help with all of this? Essentially, I want you all to focus on your posture. I know it seems like a silly thing to do. It's tough with technology and how it's affecting our body because there's no immediate pain after sitting down for an hour or so or looking down at your phone for an hour. We are kind of trained to, if we do something and it hurts, we don't do it again. However, technology more so falls into that realm of micro trauma. So it's the macro traumas that we feel, like getting injured in a sport, anything. You're just being active and you fall down. That's a macro trauma. You immediately feel the pain. A micro trauma are the little things that happen over and over again that add up, but when they're happening, you're not actually feeling the effects. And of course, you know, with our spine, we can't see it. So we can't see that extra pressure on the joints. We can't see our discs degrading. We can't see that our spine's not looking so hot anymore. We can see our teeth, so we brush our teeth all the day, every day, I hope. But we can't see our spine. So it's tough to focus on posture, but you really, really, really need to. And some tips that we like to give people are pop sockets are a great invention for your phone. If you don't know what that is, it's a little thing on your back of your phone. You can pop it out so that you can hold it between your fingers. That makes it much easier to keep your phone up here in front of your face instead of down here. So keep your phone up. It's not difficult. If you're looking at something on your phone, just bring it up to your face. And stretching out the neck is always great to do because you're tightening up muscles when you're in bad posture for a long time. Easy stretches, you know, just go forward and back, side to side, and rotate. Not that fast. You're going to hold each position for a couple of seconds and just kind of constantly keep everything stretched out. Rolling out on a foam roller, especially because that low back and hips and all the muscles down there in the legs are going to get really affected by all the constant sitting. And in terms of the rolled forward shoulders, you want to stretch out pectoral muscles. The best way that I recommend that for patients is to get a foam roller and lay on it lengthwise. So it's all the way from your head down to your sacrum, or tailbone is what you probably call it. You want to lay on that, let your arms drop to the ground. You're really opening up the chest. You're stretching out all these muscles here. And doing wall angels is also a great thing to do because, again, you're stretching out while you're strengthening. So you're strengthening your rhomboids and all the muscles to help keep your shoulders back. You can easily YouTube how to do wall angels, and they're easy to do at your home, just standing in front of the TV. You could get up while you're sitting and stand in front of the TV, do a couple wall angels, and you're helping out your posture big time. Like I said earlier, just get up and walk around. Some people put alarms on their phone to remind them to do it. I have some of my patients just put sticky notes on their computers and keep moving the sticky note around every week so that they actually notice that it's there. Reminds them to just focus on their posture, get up and walk around. Let's see. What other recommendations? Plenty of stretches, strengthening, like I was saying. Google's a great way to find some things to do for that because text neck is really well known. So there's a lot of resources for that. And then, of course, I would be amiss if I didn't tell you that chiropractic helps with all of this. It's much better that people get involved with chiropractic before they end up with these really bad postural changes or changes in the curve of the spinal cord, because then we're not having to combat anything. We would much rather you avoid that in the first place. But we do have at our office an awesome thing that we do is we take an image of somebody's posture the first day before they start getting adjusted, and then we take it again about 4 weeks in. And it's amazing how much posture changes just from getting adjusted. And like I was saying before, the body wants to be in a healthy state. And this is something we talk about all the time in chiropractic school. We are a self-healing, self-maintaining mechanism. So as long as we do the right things for our body wants to stay healthy. So our body wants to be in the correct posture. It does not want to be uncomfortable. So just by getting adjusted, you are helping with that. We want people to do all these other things in addition because we don't want you taking backward steps. So you're still going to improve, but say you're taking 2 steps forward when you come to the office and you leave the office, you do all these terrible things with your posture, you're taking 1 step back. So you're only about this way. We want you to take steps forward and not go backwards again. So you still have to make sure to do all the things that I was talking about. And then chiropractic, of course, just allows all those nerves that are having issues communicating because of the posture, we are stimulating those nerves to make sure that they function the way that they are supposed to. So I hope this was a little bit longer than 10 minutes, I'm sorry. But I hope that this was some good information and that you actually listen to it and try and be better about your posture. I'm not telling you to be perfect. I'm not perfect. There are times I catch myself looking down and need to correct myself with my posture, or when I get tired and start to slouch. But at least starting to focus on it's going to make a big difference. And I hope that you got a lot of good information about this and that you share it with others. Bye.